People regularly ask me, they ask you, should I get a dry sauna? Should I get an infrared? We can quote loads of research. In fact, I think one of the most famous bits of research is about Finnish men who have 3 or 4 saunas, and this is research that's gone over for 40 plus years. Will live 8 to 10 years longer, but they've got that research from Finnish men, whereas infrared saunas have only been around for a little bit of time. Do you think the research on infrared will look similar in 20 to 30 years? Do we just need to be patient and wait for the research to catch up?
It's a loaded question, and I could argue both sides yes and no. I think there are some distinct differences here. The infrared doesn't heat up the air around us. The infrared penetrates the body, heats up the body, and then the body's response to that is to sweat. And one of the benefits of it is sweating. I think the traditional or the Finnish sauna, of course, heats up the whole room, which is why people like to be in this hot room sharing the experience. It's hard to know. What I've noticed in the literature, and we'll get into some of these studies in a minute, is that the infrared sauna literature, particularly in the health and medical research, it's very targeted to specific ailments. Yeah, it's very targeted to either musculoskeletal, some work in heart and heart failure. Whereas when you look at the sort of dry sauna, sort of Finnish style sauna, what you see is this observational data. And one of the criticisms of the observational data people say is, well, is that to do with the type of person who goes into that sauna, as opposed to is the type of person who goes in the sauna 3 times a week, are they health conscious? Is it because they're in the gym? And what is it about them that's actually resulting in the beneficial effects we see? Why I get so convinced about the traditional or the dry sauna is because there's a few things in there, and we'll get into the detail as much as you want. The first one is that the more times you're exposed, the greater the benefit. If we look at most medicines, we see the same thing. If a cardiologist puts a person on a beta blocker drug to drop their heart rate, they put them on 5 milligrams, you see a drop of X beat. 10 milligrams, X beat 20 milligrams, give too much, and of course you can drop it too much. So you get this almost predictable benefit. And that's what you see with sauna, that you don't see with a lot of other sort of in vogue health things that people do. The second thing is that the duration in the sauna within the session seems to have a linear effect with the benefits as well. With studies showing that, you can get a 7% reduction in cardiovascular events or cardiovascular risk in somebody who's exposed up to 11 minutes in a sauna, whereas you get almost a 65% reduction in somebody who's exposed to 20 minutes in their session. So whatever way you look at the exposure, either frequency of visits or duration in there, you seem to see a dose response effect. And that's why I think we haven't seen enough literature from the infrared sauna literature just yet. But most experts in this area would hypothesize that we will see that as soon as we have enough literature. Because at the end of the day, both methods create a heat response, and physiologically, the response is very, very similar.